Good afternoon, everybody. Thank you for joining us. Welcome. We are very happy to see so many of you in the meeting. As always, we'll just be quickly going through a few little things before we start, and then we can go ahead with the training portion. Right. Just try and figure out how this thing works. Welcome to the first meeting. The second meeting. We have disabled the cameras and the microphones for the attendees because there's so many of you. We just need to keep some control over it. If you need to speak, please raise your hand, hold your questions and everything. If you want to speak with your questions, just hold it for after the training session. And if you want to use the Q&A section, please do that. Please remember, as I say, questions will be dealt with after the speaker's presentation. Use the Q&A section. If you can't use that, you're welcome to use chat. And you have to attend the whole training session if you want to get CPD points. And remember that only current Sashon members will get a CPD certificate. There are quite a few polls today, and I want to very quickly just launch one so that you can see how it works. If you hang on just a few seconds. My computer's old, it takes a while to load. And it will be the one. There you go. You can tell us how you're feeling today. The names are not recorded, so you're welcome to share. Okay, thanks. Then just to remind you, this meeting, the chats and the Q&As it will be at different places for you probably, but this is where you will find chat and QA. I've also, if you see this little icon at the bottom, it says that this content is pinned in the chat. You must please go and look for that if you want to review it. A lot of the important stuff I've put in the chat for you to see again later. Right, agenda is opening and welcome, which I've just done. Welcome. And then we're going to hand over to Garen, CFP Brokers. Nolene is joining us, Nolene and Lauren. Our training topic is history taking. When we're done with that, then we're going to go through the minutes of the previous meeting, have portfolio feedback, and then we'll close the meeting. Good. As I say, Nolene is on the line. She's ready to share her presentation. Nolene, you're welcome to. Lindy, I hand over to you just to introduce Nolene, please.
Thank you, Janit. So as Janit said, Nolene is from CFP Garen. They are responsible for our indemnity. If you're a Sashon member, you get indemnity at a reduced price from them. And she's going to chat to us today about the importance of informed consent. And before you do any history taking or seeing your client, and the effect it might have on your indemnity if that is not properly done. So thank you, Nolene.
Thank you for inviting us, and thank you everybody for taking the time out to listen to us today. I'm just going to give one apologies. I am busy getting better from COVID, so if I cough in your ears, I am terribly sorry. I will try and mute myself quickly if I can. Okay, so today's topic, the importance of informed consent and history taking, and how these two link very nicely together. And you'll see that little saying there, things don't go wrong, they start wrong. So that's a phrase I heard from one of the claims managers this week, actually, at I2. And the more I prepared for this presentation and I dealt with client claims, etc., the more I realized just how true that saying is. Things don't go wrong, they start wrong. So that's thread that you're going to find that thread throughout my presentation. Okay, let's move on to the next slide. Okay, so occupational health nurses, you work in a regulated field where informed consent is not just best practice, it's a requirement. There are SANC regulations that you have to comply with. There's also the patient charter, patient right charter, and other regulations which put patient confidentiality or your client's confidentiality right at the top. Failing to obtain proper consent can lead to various legal and ethical complications which can be avoided if this is done properly up front. Today, we're going to discuss why informed consent is critical and how to manage it effectively. And I'm going to highlight why it's a condition of your medical malpractice insurance policy. Let's first start off with history taking related to informed consent. A thorough patient history supports informed consent by ensuring that the patient understands their current medical conditions, any risks that they may be facing, treatment options. You might need to tell them that they need to go and see a GP, etc. And proper documentation protects both you and your client in case of a future dispute. Essential elements of history taking include medical background, so these are past and present conditions, medications, allergies, and other factors that influence this individual's health. Then you need to look at the occupational exposure, work-related risks, hazards, substances, ergonomic concerns. So for example, if in medical background you realize this person's an asthmatic, but they're working in a very dusty environment, those are very important for you to note and to explain clearly to the client what the implications are and what their options are. Then there's things that we don't often put right up front there. I know that I sometimes don't think about it. It's lifestyle, mental health, stresses, and these can be stresses at work, stresses from the home environment, all sorts of things. Even sometimes living in South Africa can be stressful, especially if people are having to walk home when the sun is setting in winter. There's various things that add stresses. And then legal and ethical considerations. A patient or client needs to understand the information that is being collected from them and why is it being collected from them. As an occupational health nurse, it's extremely important that you document consent explicitly. So what do I mean by this? This means it must be written and written in detail what this patient has agreed to and not agreed to. And the reason it should be written, even though the law doesn't always stipulate written, is because verbal consent cannot be proved when under dispute. It becomes a case of he said versus she said, and usually it's the person who has suffered the loss or some kind of injury who is believed over the person who should have known better and taken those notes. Then you also need to be very cognizant or aware of data privacy laws. So we've got the POPI Act, you've got your SANC regulations. Earlier I also mentioned the Patient's Right Charter, and all of these put one of the things at the forefront is being very aware of patient or client confidentiality. So here's our saying, things don't go wrong, they start wrong. And this is very true in the medical malpractice arena. Mistakes and legal disputes often arise not because something suddenly goes wrong, but because a critical step was overlooked right from the beginning. And I'm sure if I could see Lauren's face, you'd probably be nodding right now. Failure to obtain proper informed consent can lead to misunderstandings and disputes over what was agreed upon and potential liability claims. Obtaining various types of consent, so it's not just informed consent when it comes to assessing the client's medical condition, but it's also the consent to share information. This shouldn't be viewed just as a tick box exercise. It's not a matter of here's the form, sign it, thank you very much, and you carry on. The information should be clearly explained to the client and documented. What the client does and does not consent to must be written. And if you see them a year later, like many of you do, don't assume that what they consented to a year ago will still be the same right now. So, for example, if you imagine a client is not fully informed of the risks that are related to his current health condition and situation, his work environment, and the need to go and seek outside medical assistance, later this client could experience an adverse outcome. They could get really sick. They may later claim that they were not advised of the seriousness of their situation. Additionally, if consent does not explicitly cover sharing medical information with the employer, you as the occupational health nurse could face a breach of confidentiality complaint if you do proceed to share information with the employer. By ensuring that consent is properly obtained and documented right from the start, many risks can be mitigated before they even develop into serious problems. So as you see there, things don't go wrong, they start wrong. So why is informed consent crucial? As we've noted earlier, it's beyond being a legal requirement. It's also an ethical obligation. Your clients have the right to understand and agree to the services they receive. It also protects you and your team from potential legal issues in the future. Valid, you see, there can be valid informed consent and invalid informed consent if it ever goes to court, even if it's written. So what is necessary in order to maintain valid informed consent? So this requires, the first point there is capacity, or in other words, can the client understand what you are explaining to them? So a good way of doing this is asking a question or getting feedback, getting them to explain in their own words what you have discussed with them. Voluntariness, this is an interesting one. The client mustn't feel coerced into or pressured into consenting. And this can be tricky, especially if they're worried about losing their job if they give you information or if they engage with you in this manner. Capacity and comprehension are related. So have they fully understood? So it's one thing to parrot something back to you. It's another thing to fully understand the implications and the situation they find themselves in. And disclosure, have all the relevant details been explained to them? So sometimes this will take a little bit of time depending on the situation you are facing. Then, very importantly, is best practice for record keeping. You need to ensure that you keep your documentation in a secure location. So if it's kept electronically, it needs to be secured. I know that's not many of your responsibility, as your employers also will be responsible for that. But it's also got to do with paper records. So not leaving them lying around on the desk for somebody else to inadvertently see what they're not supposed to be seeing. You need to record decisions made at your sessions with your clients, actions that you've recommended, and any other communications. Ensuring transparency and clear communication will ensure the safety of your client and your own legal protection. So this was also mentioned earlier. I've extracted on the screen there in italics the wording that you will find in the policy. And you see those first few words, it says it is a condition precedent to liability. So that little legal word precedent means that there's no wriggle room. This is a very strict condition in the policy. So unless it was an emergency situation where you obviously can't get the client to consent and you've been asked to help until an ambulance or something arrives, and you're doing what we call a Good Samaritan Act, there it's understood that consent is not, you just can't do it sometimes. But where it's just your normal work, and if you don't have this consent in writing, you will not be covered. So just take a note there, written, verbal can't be proven. It must be provided prior to any kind of services. So you can't have a session with a client and then afterwards say, oh, by the way, please sign here. So you'll be aware of that. And that's where I end. Any questions? Lauren should have been looking at the Q&A. I can't see it, but any questions?
You can raise your hand if you've got a question, then we'll unmute you. Anybody? Speak now. There's one. We've got one taker. Okay, you can unmute your mic.
Hi, I just wanted to know, you said must include permission to share information with relevant parties, including the employer. So when we do medicals, we get access to all sorts of information that should not be shared with the employer. So can you elaborate on that topic?
So that's a very good one. So you would have to explain to the client what information you would be allowed and would intend to share, and what information would remain confidential, so that they can have a clear understanding of their current situation and what information is allowed, and then that can be documented. So if you ever share something that you were allowed to share, and then they say, but they didn't know or they didn't let you at the time, you've got the evidence that in those cases you did share certain information that was allowable.
Thank you very much.
Pleasure. Anybody else? Lindy, you can unmute your mic.
Nadine, on that question from Carol, the information that needs to be on the consent. So I can make a tick box and say I'm going to do a health assessment, audiogram, Sparrow, and I'm going to do it for the next year. So you're signing the 1st of January and I can then do all of that anytime?
Okay, so now let's pretend I'm your client. Okay, and you've just said to me those boxes. I'm going to look at you blank-faced. Okay, I'm cheating because I went to your AGM and I learned a few of those things. But if I was a worker in a field or in a factory and you said you're going to do a Spiro, I'm going to be like, what is that? Why do you need to do it? So you have to actually have more than just a tick box. It has to show that you've explained it and that they've understood it. So what I've seen once, which I thought was brilliant, I went to an ophthalmologist. They had this little pamphlet that explained the procedure that I was going to. And then in the consent form, there was a tick box that said, I consent to such a treatment, and I have read and understood the information presented to me in the pamphlet and explained by my ophthalmologist. So that was clear. You could put the two documents together, and it was clear as to what I had accepted. And yes, that will be fine for a year, but the following year, it's always good to update consents because let's be honest, many of us don't remember what we've signed or agreed to a year later.
If you can also help me, I remember at the conference we talked about some legal assist with consents.
Yes. So let me let Lauren answer that one. She deals with that all the time.
So the legal assist is an automatic inclusion on the policy. So once you've drawn up that consent form, you're welcome to contact the legal assist line. They'll happily help you free of charge, and they'll go through it, make sure that any legal terms that should be included are included, and then potentially change your wording as well to make sure that it would be compliant in a legal setting.
Great, thank you.
Yonette, you had your hand up as well?
No, I was just going to ask, do we need to repeat the consent every year? Because that's an enormously time-consuming thing to do. So what we've done on our consent is we said this consent will be valid until I withdraw permission. I know that will be covered, but if we have to do that every year.
You see, it's difficult if it ever hits a court of law because they're not going to remember. So even if you use the same form that they filled in and you have maybe a couple of little, because you should have their file, then you have a couple of extra lines where they just re-sign and redate it. And you say, remember you agreed to this last year? Do you still agree to it? Then they can re-sign and redate. And then it's just like it's been updated. And if they've got any questions, do you have any questions about what we agreed to? And you can, rather than go through the whole process, but you can find yourself on the back foot if you do it once and 3 years later you have a claim because that person really won't remember what they consented to.
Good, thank you.
Also, just adding on to Nolene's there, people go through obviously different life stages, and then they could have been perfectly fine when you did that intake form, but then all of a sudden they do have different conditions they've been diagnosed with, and it's something that you would then need to note as well. So you'd be treating them differently to beforehand.
Just have a quick follow-up question.
Yeah.
Do we need to, if the people come for primary health care, sorry, you may have addressed this, I ask forgiveness if you did. If they come for primary health care, do you need them to sign consent for that? Because the fact that they are there voluntarily kind of implies that they provide consent for you to examine them.
So implied consent is lawful. They are there and they did consent. Where it's going to leave you unstuck is the condition of cover.
Mm.
So if you want your policy to cover if ever anything goes wrong, then again, yes, you need written informed consent.
All right, I understand.
Because
Thank
you must
for that.
remember that we expect your insurers to defend you. And where there's no evidence, so your written is what is your evidence. He said, she said is not evidence. So where there's no written evidence to support an argument, your defense has become compromised, which would leave an insurer in a position where they've got no defense and they're just expected to pay out any damages. And for that reason, they've put it as a condition on the policy. It's very much like when you buy house insurance, they want you to have a burglar guard and maybe an alarm system. They expect you to do something to mitigate the risk and help to defend.
Okay, and then a last question from my side. If the person can read the form and they can fill it in themselves and sign, is it okay if an admin person presents that consent to them?
So
So,
here
yeah.
I would have to hand over to Sashon and ask, what does SANK say?
Now that's a tough one.
Because that's what would happen in the event of a claim. We would say who took the informed consent, was it discussed, and then the insurers would ask attorneys to look at the governing regulations, and that's what would stand as to whether it was good enough or not. So I
Okay.
have had that happen before to me in a medical situation. The admin person went through a lot of it, but then the medical practitioner that I saw said, so-and-so discussed this with you. Was there anything you had questions on? And they did sort of a summary and to make sure that I was okay. So you could do a hybrid, but just check regulations.
The other issue with that is that the admin person is not acting within their scope then. It is your scope to be able to provide them with advice on what's going to happen. So it's very touchy and we might have a problem actually defending that.
Okay, thank you. Any other questions?
See that there is something in the chat. For each medical that we do, the client signs consent for medical examinations, tests. We then list what is going to be done. That would be the best practice. So any and every test that's done, a consent should be signed for it because it is something different each time. So that would be a great way to mitigate your own risk. Does anyone have any other questions?
No, it seems there's no other questions. Thank you, Nolene and Lauren. We really appreciate it. Nolene, I hope you feel better. Get back into bed quickly.
Thanks.
If
I
there
will
are
be
any,
shutting down.
if there are any follow-up questions, we will redirect them to Lauren for now. Thank you.
Thanks very
Perfect.
much. Bye, everyone.
Bye-bye.
What I will do is I will drop my email address and our WhatsApp line number into the chat box before I log off as well.
Perfect. Thank you, Lauren.
Thank you so much for having us.
Okay, let's move on to our presenter as Dorothy. Lindy, I hand over to you.
Right, so I think most of you know Sister Dorothy Williams. She's on our committee as well. She will be presenting history taking for us today. She's a registered nurse with an occupational health qualification and more than 36 years of nursing experience, especially in management planning, coordinating and implementation of HIV, STIs and TB with quality improvement programs. She did a diploma in nursing in 1992, got her BTEC in OC Health in 2012, did a diploma in nursing management and master's degree at the University of Stellenbosch in 2018, and a couple of more courses. So I just want to say welcome, Dorothy, and we're looking forward to your presentation.
Thank you, Lindy. Yes, Lindy. Okay. Can I share my presentation?
Yes, please do.
Okay. Is it shared?
We're not seeing it yet.
Maybe I must share it.
That's the thing about technology. You can test it beforehand, and then when you need it, it's not working.
I'm sharing it again.
Okay,
Okay, let me
perfect.
put
I'll
it
tell
on.
you if I can see it. Nothing yet.
It's on from my side.
Okay, I cannot see it.
You see it?
Let's just give it a couple of seconds. Maybe it is just struggling to show on our side. No, Dorothy, we are not seeing it.
Okay,
Can-
let me just.
Yes.
We'll try again. Share. Okay.
Yoni, do you have perhaps maybe have Dorothy's presentation and that you can share it from your side or not?
Can I send it to you, Annette, because I made some. Okay, let me just share it again.
Okay, let's give it a minute or so. Any luck, Dorothy?
It's on. I don't know if you see it. Can I send it quickly to you?
It's going to take too long. I'm going to, if you don't mind, I'm going to share from my side and you just tell me to continue. If I'm on Teams, everything else stands still.
And it worked earlier when we tested it out.
Yeah, it's okay. There you go.
Okay. So I'm on my presentation. So today we're gonna. Can everyone hear me? Can I go ahead?
Yes, you can go ahead. Yeah. Just talk nice and loud into your mic. Sometimes it is soft. Thank you.
Okay. So today we're just going to take back to history taking. It's a refresher for most of you. So history taking, like Lauren and Nolene say, we need to have consent. A good history is always the first step to a proper evaluation, no matter in which clinical setting you are. Without any history, we are lost and we don't know what's our next steps to the client or the patient. Can you go to the objectives next? So the objectives, learning objectives for today is define the term history taking as applied in a clinical or occupational health setting. Understand the importance of history taking. Identify the components and categories of history taking, and then improve awareness on the steps of how to take our occupational history. So that will be the last part. Can we move? Okay. So history taking is a structured way of gathering all that information from a client about her health. So it's important. Consent is very important. And history taking can be taken by different clinicians It can be health, it can be a professional nurse, it can be a doctor, it can be a dietitian. So we as occupational sisters or clinicians, we are also included in that. So research has shown that a history taking accounts to 90% of problems identified, and the other 10% you will get out of your physical examination and other investigations. But remember, the answers are in history taking. History taking is a skill, and the art must be mastered to reach the correct diagnosis. Remember, like they were saying earlier, you need to have consent of the patient or the client. Next. So, why is history taking so important? It provides us with a foundation for both in primary healthcare and occupational health to make the accurate diagnosis or assessment of workers' complaints and guide us to initiate an effective plan for the management. In occupational health setting, it's important to identify the problem that is work-related. History taking in an occupational setting, like I said, is to identify potential hazards and risks that can have an impact on the employer's health and duty to perform work. So to do history taking is a critical first step to building that patient-client employer relationship. And we all know what must we have. We need to listen, active listening, open communication. You need to comprehensive questioning afterwards, and clarification is ask the client or patient, is this what you said? So through history taking, you will get more and more out of your patient employee. That includes in many components. So our next one is a polling. Joannette is going to do the polling session.
Give me a second. Just want to load it. There you go.
Yeah. So I can't see it. So hope there's a lot of answers in there in the polling one. We give you about 2 minutes to complete that, and then we will move on to the answers to the questions. How's it going?
No takers yet. Yeah, there's one person says medical and surgical history.
Yes.
There's graphics.
Good.
Family history.
Yes. It's part of it. Anyone more? You can put
Occupational
anything.
work, personal health, occupational, allergies, family history, personal history, social history, allergies,
Yes.
consent. There is
Definitely.
quite a lot. It's getting a bit small now. I can't read it
Okay.
anymore.
Okay. Maybe we can move on to the answers.
Okay, good.
Okay. First of all, those who say demographics, that's the first part. It's very important. You first of all, when you do the demographics, sometimes patients or clients come with a referral letter. Look at the referral letter and just note what was in the referral letter. But trust your own knowledge. We need to do history taking. We need to do our own history taking. So what was, we will look at the name, surname, the age, and for some illnesses is related to age. The client's address is very important, especially in occupational. Where do you stay? Do you stay near an industrial area? With demographics, a clinician is giving like a rough idea of how presenting health complaints could mostly be linked to certain. Can we move on to the next one?
Yes.
Health complaints. We start off with a single-ended question. So we can say, you all know this. Tell me, why did you come here, or what has brought you here? What's wrong with you? It should be in the client's own words. We mustn't put any words in the client's mouth. And remember, at this stage, maybe the patient or the client were waiting for very long outside. The patient is very nervous, anxious. What we as clinicians do, make them smile, make them feel welcome. The next one, the presenting complaint or the health problem. This will sound like primary healthcare, but it's all linked into OC health also. So this should be the most recent symptoms problem, followed by further symptoms. Don't forget to add the duration, and also remember to use terms that's understood by the clients or the patients. The next one, the review of the body systems. This is just a history taking. This is not the actual examination of your respiratory system, your CNS, your CVS, the GIT, and you know all. So this is just a question to give you more information on your client or patient. The next one is past and surgical history. Remember to ask, especially for female, your procedure, your C-section, your reproductive health. So this will also guide you into getting more information. We will later look at the difference between primary healthcare and occupation. The next one is your drug history. Janette, are you still okay there? Drug history and allergies and what are your current medication? Are you adherent to your medication? And for how long are you on this medication, or how long are you maybe using alcohol or using substance? And sometimes also you can ask, are you using any other like herbal medication, traditional medication? Part of this also assess, are you allergic for any medication, any food stuff, any eggs, allergies, especially when you have to give influenza vaccination. Yes, can we move on to the next one? Family history. Okay, so the family history, there is this, I don't know if I touched previously on this acronym. It sounds so not nice, but it's, if you can remember, it's diabetes mellitus, epilepsy, asthma, TB symptoms, HIV, or it can be hypertension or sickle cell disease. So that can be also part of the history. The last part is the social and personal history, and here it comes where occupation plays an important role to rule out any occupational diseases. So what work are you doing? What are your lifestyle? Are you doing physical examination? What is your financial situation, your social? Where do you live? What's your diet? Are you smoking? The duration of how long are you smoking? And what for how many years? Important when we do spirometry, you ask all those questions. So what is the source of your water? Where do you stay near a river? The alcohol consumption, what is the quantity? Yes. And also part of this, you ask also important about your sexual history. And remember, if you must assess the area where you're asking this question, this must be all asked in private, and because it's confidential. And part of the last part of this, did you travel, you travel recently to out of Africa, to tropic islands or anything? So that is that's part. Okay, so can we move on? Janette, where are you now? Oh, the differences. Are you by the differences?
Yes, it's showing on the screen.
Okay, so yeah, nicely set out the difference between primary healthcare consultation and occupational. So the purpose of each component can vary depending on whether the assessment is for primary healthcare or whether the assessment is for occupational health assessment, as they have different focuses Here is how health components play out. Primary healthcare, the purpose of collecting data is to understand the patient's gender, health status, and any factors, age, your socioeconomic status may have an influence on your health. This data helps in overall medical care and health planning. For occupational, demographics and occupational health context may be used to ensure that the individual is fit for the specific demands of the job. It also helps determine if workplace health risks are associated with your age, gender, or other demographic factors. The next one, the health complaints. In primary healthcare, health complaints or the systems are the primary reason people seek medical help. This allows the healthcare provider to understand the symptoms and start diagnosing or treating the underlying issue. In OC Health, we are more focused on how work is related factors like physical demands, your environmental exposures, or stress. This may contribute to these symptoms. The focus is often on workplace wellness and preventing work-related injuries or illnesses. The next, presenting of symptoms. In a primary healthcare, you do the symptoms in diagnosing the current health issue and understand the onset, progression, severity is essential for developing a treatment plan and also for diagnosis. Occupational setting, it's the presenting symptoms is explored in relationship to our job tasks, the environment. For example, the health professional may look at how the symptoms relate to a specific job function. By example, musculoskeletal issues from repetitive tasks, exposure to hazardous substances, and all the noise and everything. Review of the body systems. This is a general, most holistic approach to evaluating the entire body in primary health care to identify any undiagnosed issues, conditions, or imbalances across multiple systems. It's part of your routine health maintenance. That's primary healthcare setting. So when you do the occupational health assessment, this review is typical more focused on the systems that might be directly affected by your work, such as also your musculoskeletal system for your physical demands, jobs, respiratory for those exposed to chemicals or dust, or hearing, or those in noisy environments. And we move on. Drug and alcohol, smoking, medicine. This information is used to understand the patient's lifestyle in primary health care and the overall impact it can have on the health. It also helps in managing medication, diagnosing health issues, and identifies risk factors, especially with heart diseases, hypertension, diabetes, cancer. In occupational health assessment, identify potential risks that could affect your job performance. For example, when you use alcohol and drugs, you may impair the ability to perform certain tasks. Your smoking history may influence your disease if you have a lung disease in a specific work environment. For those who work in construction, working in dust, working in the manufacturing area. The next point is your past and medical surgical history. In primary health care, this provides valuable insight into any pre-existing conditions that could influence current health, concern, or complicate treatment plans. It's a key part of holding an individual health record. So we're moving to occupational. Why you do it in occupational? Yeah, past medical and surgical history is often relevant to determine whether an employer is fit for certain physical tasks or whether any pre-existing conditions might be aggravated by the demands of the job. Example, someone with a history of back injury or back surgery may need modification in a physical demanding job. The family, next point, family history or illness. Primary healthcare seeks to identify genetic relationship to certain conditions or diseases, such as heart disease, cancer, diabetes. It's crucial for preventative health strategy, for screening, so regular screenings and wellness. Occupational family health history may not play a central role here unless there is a specific family history or work-related condition. So, example, genetic relation to lung conditions in environments with hazardous exposure. Maybe one of the family members are also working at other factors where they are also exposure to hazards and risk. Social and personal history, important in OC health, but in primary health, this provides into patients' lifestyle, living conditions, stress level, and access to resources. Occupational, in this context, social and personalism may focus more on the factors that affect workplace performance, such as living conditions, support system, your mental health status. And for instance, if stress or personal issues are affecting your job performance, this might be addressed in relation to manage workplace stress. So in summary, OC and primary healthcare. Primary healthcare focus on the individual overall health, treating both current issues and preventative care, and it looks at a broad range of factors impacting health. OC health centers on how the individual health interacts with their job, environment, and workplace safety. It aims to assess fitness for work, prevent work-related injuries and illnesses, and ensure that the workplace is safe for the employer. In both contexts, these health components are important, but emphasis changes according to whether the assessment is for the overall health maintenance of the job description. So we can move on. I'm just going to see now. So now's the important part. How to take an occupational history. So the background OC health is heavily influenced by the type of occupation. The job we are doing, we spend most of our time, adult life, working. So the question was raised by Bernardino Ramzini, the father of occupation mental health, that with each history taking, with each interaction with the patient, you ask about your occupation that you employed in. So our work is affected by many factors. We have positive factors, we have negative factors. So the positive ones are we have a job, we have money, we have benefits, companies money, we have life policies, we have everything. So we have a purpose for life. But the negative effects can be at work. You can experience harm, injury, exposure, and the effect on the physical. It can have an effect on the physical, our social and psychological well-being. And move on. So it's important to do occupational health history as part as history taken. And the more you practice, the more you get used to it. So what are the benefits of occupational history? The benefits, just at 4 points: to identify work-related symptoms, make an accurate diagnosis and address the cause of the disease. If you address the cause, you can put steps in place for further prevention of exposure. And if there are such exposures and hazard, it's time that we need to review our health and safety policies. So occupational history is important for pre-employment. So for past exposure to hazards, to create a baseline to evaluate the future risk of developing injuries while employed. The health surveillance is important, especially to monitor employers that work is in areas, high-risk areas, exposure to a particular hazard like asbestos, silica, and organophosphates. For many exposures, employers are legally required to do annual health check. The last part, fitness to work assessment, to monitor if the client is fit to work, continue, or do light duty. Before any claims could do for the duty of the employer and the duty of employers towards work. We can move on. Messages, how to take an occupational history created from the online pictures. Okay, so the first step is the symptoms. Symptoms important. This is the questions you ask when when a worker or employer comes in. The first question you have to ask, describe your clinical symptoms. So here you will use, again, open-ended questions. It's important because employers describe most of the time the common medical problems such as rash, such as a headache, asthma symptoms, and other symptoms that's not part of occupational health. So it's important for you to find the link, the relations, questions in work exposure. Some questions that you can ask. Do you think your work is contributing to your symptoms? It's open-ended, a yes or no. Has there been any changes in your work routine? Are your symptoms better when you're off, better or worse when you're off work, or a few days, or compared when you return back? Does your colleagues at work have similar problems? You will ask for any relevant past medical history relating to the exposure. The next one. So, second question, what does your job involve? What kind of job are you doing? To have a job title is insufficient to tell I'm a general worker. So, general worker can be anyone in any place. So, example, general workers are using different tasks and can be used in different departments. They can operate machinery, they can working on heights, they can be boulders, they can work with dangerous material, or they can carry heavy items. So your job title doesn't give you enough information to know what type of work are they doing. So are you exposed to, you also ask, are you exposed to any medical fumes, noise, dust? Another question you will ask about is the duration of your job. How long are you working per day? How long are you exposed to maybe noise? When did you start this role? How many hours per week are you working? Are you continuous exposed, or is it a combination of the exposure? So it's important that prolong or the short time frame of it. You will also ask about the intensity of exposure. Example, is dust in the air? Can you smell the chemicals? All those type of questions, you know, and we long in occupational, so you know what to add and what you can add more. So the next set of questions is about the workplace environments. So you ask, is this an indoor? Are you working indoor or outdoor environment where you work? What sort of work are you performing? The process of the work you're performing. Are there adequate ventilation in the place? And is it working? We see air cons or ventilation, but is it really working? Is it in a working order? Are there adequate controls to minimize that exposure? In terms of PPE, what type of PPE are you using? Are you compliant? Are you wearing it? Or is the earplugs hanging on your neck and you're not using it? Does it fit properly? Are all those equipment that you use for PPE maintained? Then the general hygiene in your work environment. Do workers smoke at work? Are they eating in the same area where they have to work? How often do you wash your hands? That's also important. Are there basins to wash their hands? You can also, part of this, also ask workers to describe their previous roles and any associated exposure to work towards their work. Okay, and finally, environmental history. Important. The reasons for this question is to identify certain important in-home or nearby environment. Are there any change in the residents due to a health problem in the area? How old is your house? What type of roof? Is it asbestos? Is it old? What type of pipes are there? And is the house molded? Are there any other exposures, example, living near a factory, industrial, near the river? And a most important question, I mentioned it earlier, your family members, where are they working? Are they also working in factories where there are possible hazardous materials also, or dust at home? And what type of chemicals are you using? What are your hobbies? Are you working on motorbikes the whole weekend when you're off duty? Are you attending loud discos every Friday night or that? So that's important questions you have to ask. Okay, so I think that's part of the end of this. Joannette, do have a quiz to see just to test your post knowledge on this? Joannette?
The quiz is on. There's 5
Okay.
questions. Just move the arrows at the bottom to move between the questions. And then there's a submit button after the 5th question. So you can just start answering.
How's it going, Joannette?
Oh, it's the questions are long though, concentrating.
Okay.
Elaine Rousseau asks us just to identify work relatedness.
Work relatedness. Oh. It can
Oh,
be
so she
like,
says, sorry, she says it's not a question, it was a statement. Sorry, Ellen.
okay.
Hey. All right, so most people had the first question correct, second one correct, third one correct. Oh, wow. Okay, most of the questions correct. Of there's 9 responses and everybody's been correct so far. So they listened to you. Can we
Okay.
move? Can we move on?
Yes, we can move on. I can't see the questions. Maybe Joannette, can you maybe just answer the
That
question? Is everything correct?
yes, they'll see the correct answers on their side.
Okay, thank you. So in summary, occupational history is a critical component of history taking. A person's occupation can involve many duties and potential hazards. Specific questions need to be asked to obtain this information. It will allow the clinicians to implement an effective management plan. So thank you very much. That's just the resources that I found, and if you want to look on there, it's very nice. It's nice information on internet, and this is our very first book, the Viljoen book, and the other one when I did occupational health. So it's the information is so good, so the same. Thank you very much. I hope it was a refresher for everyone. Thank you, Annette.
Thanks. Okay, can we move on to the rest of the meeting? I just need to get to my next slide. Okay, let's continue the meeting quickly before we do the portfolio presentations. Has anybody read through the minutes? Anybody willing to accept the minutes? Kathleen de Villiers, thank you. Kathleen is accepting the minutes, and Petronella McLean, I assume you'll be seconding the minutes. Thank you very much. You just write down the names, because I can't type that fast. Good. Next one. I just want to remind you again that if there's anything that we need to put in the chat, pin to the chat, there will be a little bit of a little icon at the bottom. All right, so EXCO feedback. There's several topics that were discussed at EXCO. They want the regional chairs to approach all auditors to find out if they still want to audit. And then also what came out of EXCO was retired members can still audit, but they must be SASHON members. And there's also the training of new auditors have been discussed at EXCO. So we must just first go and find out who still wants to audit, if they are available, and whether there are SASHON members, and then new training will be arranged if needed. They also mentioned that there's different ways of getting CPD points according to the SANC framework. The Regis must communicate it to the members. I think we will do this closer to the time, but we can discuss it later. Regions must adopt one or more tertiary institutions in their regions and get involved with the undergrad students and encourage PGDIP students to write articles, especially on case studies. Lindy, she has made contact with CPUT quite some time ago already. So we've adopted CPUT, but nothing stops us from approaching some of the other universities. We're very blessed that we've got 4 universities here down in Cape Town. And then I think of 3 of them offer the undergrad nursing degree. Not sure of University of Cape Town, but we can look at that. And then portfolios for the Western Cape EXCO rep. They have granted me, in their wisdom, the portfolios of PRO, newsletter, and skills development. The skills development I share with the National Ed rep. So I'm stuck with a newsletter. Please help me with that. I need somebody or people to give me topics to write on. Adele, I hand over to you to present the finances.
Good day, everyone. I just wanted to share with you our transaction account is standing as it is on the 24th of Feb on 3422.62, and our sorry, that was the current balance, and our savings account where we do our bulk savings with our credit interest is standing on 173,850 and 10.21 cents. Our expenses were 550 that needed to be paid to SASHON National. We had EXCO expenses. Your net went up to EXCO, and there was parking expenses. And we also bought flowers for passing of one of our members' husband. And then we've got just a normal interest or anything, small amounts like that is standing at 3422 and 62 cents. We are hoping to get some more money in when we do our workshops, because we definitely are marketing to get our finances a little bit up. That's it.
Sorry, Adele, I threw myself out. Let me just get back. Okay, thank you. Anybody who will approve the finances, please, or accept it? Kathleen, thank you. Anybody else? Petronella, thank you. Anybody to second it? Anybody who wants to raise their hand to Mariana? Thank you, Mariana, for seconding that. All right, wonderful. Thank you all. Just get back to click. Lindy, I hand over to you to do your presentation. I'm going to stop sharing.
Okay, see, is it sharing?
Yes, we can see. Thank you.
Okay, great. So I've got the three portfolios, the Education, Student Affairs and CPD. So I want to welcome the CPD students of 2025. There are a couple of them in today's meeting. So welcome. I hope that you have learned something with Sister Williams today, and we hope that you will continue joining us on, especially on our general meetings where they're on, which are free of charge for you guys this year. You all met me when we had that Blackboard meeting on the 18th of February, and I have introduced the Sasha Western Cape year plan for this year with them so that they can join us. So thank you for joining. Right, CPD, Joannette, are you going to chat about the CPD? Shall I leave that for now?
I can. Can I interrupt here and go on with it?
You can.
Okay. Good. There was a long discussion at our previous committee meeting, and the question has been raised, what is the CPD points doing for us at the moment? You know that we've been getting CPD points for these meetings for the past 5 years since COVID, but it's done on the HPCSA template. It's not SANC related. It's done according to their criteria, which is different from SANC. So it makes it kind of, it's not going to be like that when SANC eventually gets their CPD program going. Secondly, it's costing the region quite a lot of money to issue the CPD points at every meeting. And I know we sent you the certificates. We will continue doing that. But in order to save a little bit of money and a lot of effort, you can imagine if there's 90 people in the meeting, how long it's going to take Lindy to issue those certificates for the CPDs. So if to save us so much effort and also the cost, it was decided to discontinue the CPD applications. The last one will be today. We will still issue CPD application for today, and we will apply for CPD points for the workshops. But for now, for the meetings, we're not going to do that every time anymore. We will still issue you with attendance certificates, which it will be sufficient, I hope, for your employers to accept that as attendance of the meeting. The same rules apply. You have to attend for the whole part of the training session, and we will introduce the different categories that SANC as the CPD points under. We will start to introduce that on the certificate just to get you a feel of how it's going to work. Nobody's quite certain yet of exactly how it's going to work, but I'm sure we will find out soon. So if there's any questions or concerns about that, please feel free to either share it on the group or to contact me or Lindy. We are very happy to share our thoughts behind this. If there's any specific challenges that you're going to have with regards to this, please share that with us too. It's not a decision that was taken lightly, but it's not, it's really not, the CPD point specifically doesn't benefit anybody at this stage. So we'd rather continue with that once SANC has sorted themselves out. Thank you, Lindy.
Thank you, Joannette. Just to add to what Joannette said, so 5 years ago, I wasn't part of the committee, and the Western Cape was targeted by EXCO to pilot the CPD in the Western Cape. So currently, it was only the Western Cape region doing the CPD points, And the whole idea was to see if it's feasible to be able to get 15 points per year, because that's what SANC wants from us. They've got 5 areas. You'll see on your January CPD certificate, I've added it, and I hope I can remember it, but it is your area of practice, it's research, it's teaching, it is leadership and management, and there's another one that I can't remember. So as Janette said, we will obviously stay in the rhythm of when we do topics at our general meeting, that we will cover all that areas that SANC needs from us. And there are a SANC meeting tomorrow, so hopefully we will have more information from them. So you can go back, look at all your certificates that you've received the past 5 years, go and count and see where you're able to get to 15 CPD points. I know I was able to, so that was the whole idea with the pilot study. For each 1 CPD point, Sashon Western Cape pays 870 Rand, which is quite a lot of money in a year's time. If we do 10 meetings, it's nearly 10,000 Rand. And for that reason, and because the current CPD points is accredited by the HPCSA, and it's you can't apply in July if SANC now gets all their ducks in a row, and you can't, when your CPD with SANC starts in July, you cannot use today's points. Okay, they don't work retrospectively. So we thought of putting it on ice, keeping the system that we have developed, because it is working, and the moment that SANC then starts to require that from us, we can continue. And as Janette said, if you do need a certificate of attendance, we will obviously give that to you. Right. May you please share the ways of gaining CPD points and how many points are needed? Right, so it is 15 points. There are 5 areas, and as it hasn't, there is a document that I can share on the group of what SANC is trying to implement, but as we said, it's not yet implemented. Hopefully after tomorrow's meeting, we will know a little bit more. Right. Then for next month, we have a workshop. It will be held at the Durbanville Conference Centre again. It is about the Balancing Act. I always feel that as an occupational health nurse, I am the middleman between the OMP, the AIA, the employee, the employer, and we need to balance this act, that from what he is exposed to, what we need to test in the environment, to what we need to do for this employee. We have very wonderful speakers. If I can go back just to the next slide, we are starting off with a case study. Then we're going to talk a little bit on hazard identification, risk assessment. And then we have Fane Creer from SiteNet Africa talking to us on occupational health hazards for physical, mechanical, chemical, and biological. And we have an ex-president, Kim Davies, that will talk about the psychosocial hazards. And after lunch, we've got Wendy van Beek, I think from Ergo Direct, if I'm not mistaken, that will talk about ergonomics, and then Dr. Heidi Williams on the medical surveillance. The cost for this is 1,600 Rand for a Sashon member, 2,600 Rand for a non-Sashon member. There will be a space for exhibitors if somebody knows of somebody that are interested. And then please, the students who are online today, you will have only pay 1,000 Rand to join our workshop. That is in March. In April, we're back on Teams, and we are talking about epilepsy in the workplace with a back to basics on eye conditions. Then we have on the 12th of May, our International Nurses Day. And then the 28th of May, we will talk on Teams again about the respiratory impairment and triage. The health calendar, National Health Calendar for March. March is TB Awareness Month. So if you want to do something in your clinic, this is maybe a good place to start. 24th of March is then World TB Day. Upcoming courses. I only have Health Science Academy and EFHA. If any of you have other information, please send it to me that we can advertise. So there are virtual and in-person training from HSA. And there you have the dates. They are in March and April. And they also do refresher courses and they also do some training online. There's a lot of information, so rather go and have a look at the brochure. And then EFHA, they start a audio spiral and vision course every month. And they have the next audio refresher, which is all online on the 30th of April, vision in May, a reproductive health refresher also in March, and spirometry in April. So again, we come to my question of the day. If Joannette can add the poll, we are getting good at that in Teams. Thank you, Joannette. So the question today is, what type of consultation does the occupational health nurse practitioner conduct when completing a fitness to work certification? So what do you call it? Do you call it, there's a type of a medical evaluation? Do you call it a health evaluation? Or a medical examination? Or a health examination? Or maybe a physical examination? Or a health assessment? Or maybe you are as unsure as I was when I started looking at all the different definitions. I'm going to give a minute or two if you can quickly just complete the poll. I can't answer the poll, Joannette. Can you see anybody else answering it currently?
Yes.
Okay, great.
We'll
I don't have to.
response details.
Okay. Mariana has added another option, medical surveillance. Alexander says health evaluation.
Okay. I've got 12% saying medical evaluation, 4% says health evaluation, 4% says medical examination, 4% says health examination, 12% says physical examination, and 65% says health assessment.
Everybody's unsure what they're doing. Wonderful. Right.
Yeah, I think I forgot to include that. Sorry, man. My
okay,
bad.
no problem. Okay. Right, so 65% says health assessment. So guys, when I got this question, we actually, Joannette and I, with Natalie and Kim, had a discussion when we were busy with the position paper session, and that's actually where it originated. And when I went and I did some research, just see what is the difference between these. The focus of a medical evaluation is the comprehensive review of the medical history and current health status. That sounds quite what we actually are doing. Looking at health evaluation, they're looking at specific health indicators or risk factors. Now that also sounds like what we are doing. Sky is exposed to noise, so we need to look at his hearing, right? A medical examination, hands-on assessment of physical health, and health examination. They say it's similar to medical examination, but a broader focus on health, where your physical examination is hands-on assessment of physical health. And here we come to the 65%, the health assessment, the holistic evaluation, including lifestyle and environmental factors. And that sounded to me like more what we do, but not really with our focus, right? Our focus is most the risk. So then they went and they said, what is the purpose? The purpose for medical evaluation is to determine fitness for work. Now, that's what we do. That's what the question is all about. Health evaluation, as well as the medical examination, is about identifying health risks and issues. So again, it can fit. Health examination, again, identify health issues, and your physical examination is to detect physical abnormalities with your health assessment as identify the health risks and promote well-being, which again then fits into what we're doing. So the scope, you can read what is the scope, and then I thought, you know what, we've now got evaluation, examination, and assessment is as our keywords. So let's go and have a look what that means. Evaluation means specific aspects of health or treatment, where the purpose is to inform decisions, to make informed decisions about the care and the treatment, and it can be broad or focused. While your examination looks at your physical health and the body systems to identify health issues or abnormalities and focuses on physical health, which is also what we're doing. And then assessment means it's a holistic view of the health and well-being, developing strategies for health promotion and management, and it is comprehensive, including the lifestyle factors. So again, everything fits a little bit. I don't know if you guys agree with me. And I thought, oh, I know the international trend is to talk about health assessment. And the reason why we are doing that is when you talk about a medical examination, the employers tend to think that only a doctor can do a medical examination. So internationally, we are trying to move away from the word medical, and they are using the words health assessment. And then I got a brainwave with a little bit of help. And I Googled, or not Googled, ChatGPT. What is an occupational health assessment? It is a structured evaluation of an employee's health in relation to their work environment, job demands, and potential occupational hazard. It aims to determine whether an individual is fit to perform their job safely and effectively, while identifying any workplace-related health risks that could impact their well-being. So I think we all know that when we do a certificate of fitness, it's not only the impact that the work can have on the employee, but also the effect of the employee's health on the work. Like Nalene said when we started the session today, she said that if you've got an asthmatic and he's working in a dusty area, that is something that we need to review, right? So yeah, my 2 cents, we are doing occupational health assessments, and this is what the international market is aiming to change the wording to. We did have some communication with the Department of Employment and Labour, so that when they do make changes to legislation, that they start using these words. Right, and that is it from me. Thank you, Janet.
Thank you, Lindy. I'm going to just present again. It takes a little time. Apologize for that. Technology is great, but it's frustrating sometimes. Just waiting. Resume. All right. Paula's portfolio, public relations. Paula, you are welcome to share if you've got anything new.
Hi, Janet?
Can you hear me, Janet?
Yes. I can hear you.
Good afternoon, everyone. Thank you, Janet, for this opportunity. Yes, we've been engaging with the Department of Health and Department of Labor in connection with the practices, and we are conducting some research with SANC with regard to the issues that we have had. So in that regard, we don't have a constructive response. But we are waiting for responses from all the stakeholders. So yeah, thank you.
Thank you. All right, so the next item on the agenda is SASOM. I'm sorry for the quality of this WhatsApp. SASOM had some challenges with their email addresses and the telephone lines. So I got this from Cheryl. Cheryl Ann, who shared this with me a few weeks ago or a few days ago. So that's the email address that they're using now, if any of you need to contact them. And then they also say that their WhatsApp channel is still up to date. So I know this is doesn't look very good. I've pinned this in the chat for you to scan the QR code if you need to get into contact with SASOM. Very easy to join. I joined their group myself. Very easy to join. Just scan the QR code and it will take you directly there. Adele, you are up.
Hi, yes, nothing new on marketing. It's just we are planning to have exhibitors for our workshop upcoming in March. So if there's anyone that wants us to maybe approach them, or you know that your company would like to be exhibitor, it will be great. So yes, you can contact Annette or myself. And yeah, is there anything else that you want me to add to marketing, Annette?
No, that's all. Thank you, Adele.
We did agree the exhibitor will be 2,600 Rand.
Yes,
to have a
that's
table
the price.
for the full day workshop.
Yes, that's the
Good.
cost for the exhibitor. Thanks.
Thank you.
Beverly, you are up next.
Okay, good afternoon, everybody. Our social responsibilities, we have decided on as Lily Rose Settlement in Atlantis, supplying food, etc. for the animals, and we are waiting a list of their needs, and hopefully starting with pet food. So if you have extra pet food you'd like to donate, please get onto your WhatsApp chats and we can make a point of picking up and delivering if possible. So please contact me if you would like to donate. Then our other project is a knitting project. It's Bless a Baby, the Mother Teresa little jerseys and blankets and clothing and toys that the knitters make. And the new thing is the fidget sleeves for Alzheimer patients. So if you have any spare buttons or zips or fluffy goods or anything textural that you can donate, please feel free to do so and making a point of us coming to collect, and we can hand it over to our knitters. Thank you very much, Joe.
Thank you. All right, so you know that I've been given the responsibility for the newsletter. Sorry, people. Just want to get back there. We need newsletter content from you for anything OC Health related, case studies, fun stories, things with celebrating health days at your site, contributions to our social responsibility project like photos and stories of other photos that you have. Our next issue is due April, May. So if you can let me have that before the end of March, please. If you just want to share photos and a quick write-up or quick explanation of what it is, you can also do that, and it will be much appreciated. Thank you very much. If you want to look at this list again, it's in the chat. And then lastly, just a repeat of the last meeting, we have started a new SASON group. It's called SASON Western Cape Members 2025. The old group was closed on the 1st of February. So if you were not added to the new group yet, you need to be a Western Cape member and you need to be a member of SASON in the Western Cape to be added to the group. So if you were not added, please let me know so that I can add you, because this is an important platform. All communication going forward is going to be sent or shared via WhatsApp, especially now that they've got that wonderful feature of events. If there's an event, please use that to indicate whether you are going or not, especially if it's a meeting. If you say not going, we can log you as an apology, and that is important going forward, especially if you want to apply for something like a bursary or sponsorship or HLM. Going forward, it's important that you say you cannot go to the meeting, because that indicates that you are an active member. Even if you can't go to the meeting, you did reply. So please use that feature. There is a reason behind that. And then also there's a link to Teams going forward, and I've also managed to get that in the WhatsApp group. So all new events or very important messages or whatever we need to share will be pinned to the on the group. I've showed you where it is. You just look under the group name, under the list of names, you will see then there's a little pin like the one underneath. It's gray and it's upright. Okay, I will share links to the meeting with, if there's anybody that's not using WhatsApp, please let me know. But as I say, we prefer to use WhatsApp going forward. It's just a much easier platform to use. Nobody reads emails anymore. At least I try and avoid it as much as possible. Okay, then. Oh, yeah, I did it. Okay, so there it shows you where's the pinned content, either message or an event. So that's where you will find it. If you want to join the Sashon group, you will need to be approved. You can scan this QR code. The QR code is also pinned in the chat. And then when we see there's a pending request, one of us is going to just look on the membership list to see if you're paid up. If we can't find you on the list, we'll let you know. We can't find you on the list, please send us your certificate, your Sashon certificate. If you can do that, that would be great, because that membership list is not updated every day. We receive it from Adele maybe once a month. So it might be that you joined after the last time she sent it to us. Sorry, we will have a look at that. And as soon as we've confirmed that you're a Sashon Western Cape member, we will join you to the group. And then the two faces behind the scenes that does a lot of the hard work, Dorothy and Serenity, thank you for your hard work. We really appreciate that. It's really a lot of time that goes into preparation of the meetings and the minutes and the agendas and so on. All right, this is just a list of your caregivers. I've pinned it in the chat, and it's also on the WhatsApp group. If there's anything you need us to help you with, contact your caregiver, or you can ask a question on the WhatsApp group. You're welcome to do that. And there's a picture of where it is. It's in the description of the group. Right. Sorry, I made this. Good. And then lastly, Sashon's contact details. This is the head office contact details. If you've got anything with regards to membership that you want to find out, you're welcome to contact Adele. I will just ask that there's a certain procedure to follow. And the procedure is to approach your regional chairperson first, which is me. So if you've got any question, please let me know. If I can't help you, then I will refer it to Adele. It's just to help her navigate through all the emails, because she's only half day there. And then Gita works with all the audio. So any audio inquiries will go to her. And that's it from my side. Any questions from anybody?
Nate,
yes.
There's a question in the chat of Saniti Munikwa that says she's in Zimbabwe, and she asks, does she need to join the group? I suppose she's referring to the WhatsApp group.
Yes, Saneti, you need to be a Sashon member, and it doesn't matter where you are in the country. If you want to be a Western Cape member, you can tell them, I want to join Sashon and I want to be a member of the Western Cape. So yes, you need to join Sashon, and you need to ask them, I want to join the Western Cape, and then we will gladly add you, no problem at all. All right, a few people saying thank you, we appreciate it. Look, non-Western Cape members, or not even members, are very welcome to join our meetings. You will just not get the attendance certificates, that's all. So if there's anything that you want to still ask, you're welcome to do that. I see Lindy wants to ask something. Lindy, please go ahead.
Sorry, Janet, I forgot to say for the workshop next month, There are 2 places for sponsorship, so all the active members are more than welcome to contact Joannette to apply for the sponsorship.
Thank you for mentioning that. Right. Somebody wants to ask. Oh, there it's gone. Somebody wants to ask a question. Let me just allow the mic. Zetu, you're welcome to go ahead. Zetu, you can unmute yourself. Okay. Seems like there's no other inquiries. If there's nothing more anybody wants to add, going, gone. Fantastic. Thank you, everybody. This was a nice quick meeting. We hope we can do so in future. If there's anything you want to know, please let me know. Send me an email. Be active on the WhatsApp group. We are here to assist. Thanks a lot. Can the committee members just stay behind, please? Just give them a few minutes to leave.